Okay, good. Everyone found a new seat, or most people?
I kind of thought I'd get new people.
Yeah, there's always one who says, if everyone else moves, I don't have to move. Every group, yeah. So this morning, thank you all for playing around. We packed a lot of stuff in there, right? We really were looking within your own four walls, so to speak, in a facility, a little mini incident in a facility. We did a lot about your own response. Now we're looking outside, right? All the partners, when things are more than just you that's impacted. So we talk about this being, the next couple modules will have a few slides where you've got lines and boxes. They're not all the same. They're all meaning different things, but we'll break it down and talk kind of about when things get that big. I'd encourage you again to help us keep it relevant to you. We can tend to be in that, there's like really big incidents, we don't get hit by big hurricanes here. Things don't get that big. But what are the small things that can get big enough that we still have a lot of that interdependency? So how do we make sure this is relevant to you? So actually, we're going to start with an afternoon kickoff. Just give you a couple minutes to introduce yourselves at your new table, your name, where you work, and a takeaway from the morning. So go ahead and talk. Okay, hopefully that gave you enough time. I would love to hear some takeaways. What did someone share with you, or your own? You shared with your own self. What are we carrying forward from the morning? Any insights? What do you want to keep with you?
Making these connections make a big difference in the future.
Making these connections makes a big difference in the future. That's why we want you to move and then, really meet people, because it makes such a difference to have a face on the other end of the phone call, right? In Module 6, we'll talk about information sharing and coordination and planning with community partners and stakeholders, and thinking again when the incident starts to go bigger to a regional level.
Mary, would you be able to contact the County Emergency Operations Center to get the latest update on road closures and EMS transport impacts?
Can do. I'll let you know what I hear.
Thanks. Oh, hang on. Hello? Oh, that's a bummer. Okay, thanks for the update. I'm with Mary now. I'll let her know too. That was the logistics chief adding a little more spice to the day. The linens vendor can't make it on site due to road closures and have canceled today's delivery. I'm going to need you to work with the unit coordinators to assess our linen stock for the next 24 hours while logistics works on contacting our secondary vendor, Larry's Linens for Less.
I'm on it.
Thanks. I'm going to head back to my office now and see what else I can find out about local impacts and what actions our community partners are taking.
There have been multiple reported impacts from this storm, including facility utility outages and road closures. Please join a coalition call in 1 hour and be prepared to share status updates and any critical resources you need for your facility. We'll provide information on next steps on the call. Hi all. Due to storm damage, we are aware of multiple facilities with impacted operations. Hospitals, please make sure to report your bed availability on Mintrack by 4 p.m. Now let's begin with a roll call and status update.
So the incident got bigger, right? What's one thing she did at the beginning? Said, I heard from someone in the ED that roads are closed. So she calls, or as Mary called the Emergency Operations Center. So we're getting that validated information. Don't just go on rumor. And then information is so valuable, right? I think information is one of the most valuable resources in an emergency. There's never enough of it, or there's too much, but you don't know if it's true, or it might be half true. So information sharing is really important. The coalition plays a key role there, and we made a Zoom call as one way that might happen. But Levite, I wonder if you want to speak to that, kind of what else that might look like besides just a Zoom call.
Okay, so for the coalition, we would probably have the Zoom call, Teams call, that would bring in everybody from our coalition. We send out an invite to everybody. Nobody's excluded. You can attend if you want. We share information as we get it from our partners and and that could be MDH, that could be EMS, emergency managers. We are kind of the coordinating of information. You want me to use a real life? Sure. So right now we have the IV shortage. I'm sure you've heard of it. And so the coalitions, what the coalitions do is we're going to pull together our people that are affected, and we'll talk about what they can do to save, to preserve their stock. And then if somebody's in critical need, then we may be able to, bad word, but broker from another facility the change of IV fluids. We did the same during COVID for vaccine. We made sure that it got down to the very basic where everybody needed it. So our main thing is information sharing and bringing our partners all together. And so nobody's excluded from our coalition, and if you are not a signed member and would like to be, because your surveyors often want to see a signed piece of paper, we do have a paper you can sign that's non-binding. Just get a hold of me and I'll get that for you so you have it. Because some of you call me in an emergency and say the surveyor wants to see this signed form, so it's nice to have it done ahead of time if you can. So, how's that?
Yeah, thank you. No, we'll have more come up maybe from the coalition perspective.
Oh, you want to?
Thank you.
And this is,
Yeah, sure. While you're
this is a very strong member of our coalition. This is, introduce yourself.
I'm Julia Wickham. I'm the Public Health Preparedness Consultant for the South Central region. So I work for the Minnesota Department of Health, but working closely with county health departments with the funding they receive specifically surrounding emergency preparedness and response. They receive a few different funding streams to carry out grant deliverables and work, and many of that also includes collaborating with long-term care in hospitals and clinics and other emergency preparedness partners.
So Levita there talked about two things, the coalition helps with information sharing and also that resource coordination or resource needs. So let's focus in on information sharing. Ignore these lines and boxes for a minute. We'll use this after, but we're going to do our first kind of talk at your tables. And information flows two ways, right? The first is when something's happening, and again, think of something, I'm going to give you some examples you'll pull from, but it's big and bad enough, it's happening everywhere or more than just at your facility. So what do you want to know outside your facility? And then in an incident, what do you want others to know about your facility? So those are two questions, and what I'll have you do is think of an incident that tracks with one of the coalition's hazard vulnerability analysis. You've come up with, you rated, I have 6 incident threats that you rated. So pick one of these. You can write these down. I'll read them a couple times. Pick one of these incidents and then answer these 2 questions at your table. So the first is tornado or straight line winds. The second is winter storm. The third is mass casualty. The fourth is epidemic or pandemic. The fifth is IT and cyber attack. And the last, relevant right now, supply chain or supply shortage. So I'll read those again. You can just pick one and answer those 2 questions at your table, and then we'll discuss. So the first, tornado straight line winds. Number 2, winter storm. 3, mass casualty. 4, epidemic/pandemic. 5, IT cyber attack. And 6, supply chain and supply shortage. Okay, so I'll give you a few minutes to talk about those at your table. About information needs. All right, let's bring it back. Let's bring it back. I'm going to come down here off stage. Let's hear what you came up with. So before we go into your answers, I'm going to just tell you about these lines and boxes. We're going to have to mentally draw some probably new lines and boxes on this diagram, but this one comes out of the Hospital Incident Command System Guidebook, which is a real good read. I've read it at least 20 times in the last. They're talking about information sharing. So The red box is your healthcare facility command center. They've only drawn a couple positions if you're using ICS. I don't, so we'll draw more because it's not only the incident commander, liaison officer, public information officer, and safety officer that communicates outside your facility. So as we facilitate this discussion, maybe we'll just kind of throw some more lines and boxes up there. So I would love a table to volunteer first. We're just going to do the first question first for everyone. What do you need to know from outside your facility? And think about where we get that, who gets it, and where they get it from. So who would like to volunteer first? Tell us what. Because I can pick one. Any volunteers? All right, here, Julia's going to bring you the mic. Thank you, Adam.
How are you on the winter storm? We're just kind of brainstorming things we would need from outside facility. Obviously, we need the forecast, areas that's going to be impacted. How will this affect our deliveries, our staffing, what's going in and out? How we're going to mitigate the snow removal. Just having what supplies that we have ready and on hand, what we need to get in.
Yeah. Okay, so let's start. Well, help me remember what that was a pretty comprehensive list. So first, you want to know about like the weather forecast. So who's going to get that and where from?
Hopefully the EBS.
Yeah.
I'm going to have that for us. So I know in my position now, we're trying to keep an eye on the weather, especially severe weather ideas. Keep an eye on that. Keep an eye on it and try to get ahead of it a little bit.
Yeah.
So.
And you're probably checking some official sources, some things that you come in. You might get reports from email or look up online. Are you going to any external entities? Maybe would you interface with your emergency management or anyone else?
Yeah, so I deal with the Meeker County Emergency Management Team. I'm on that Code Red app or something.
Code Red, yeah.
So, a lot of times she'll send out emails or messages as well, hey, this is
perfect.
So then we can kind of pass that information on.
Perfect, yeah, so good. So again, might be a liaison officer, but we might throw a different box in there and just say it's the one person in charge of everything. There you are. Interfacing up with the EOC. You talked about then knowing if your supplies were coming in, so that's maybe interfacing with vendors probably. I don't know if you use ICS, that might be, we might throw in a logistics section chief here, thinking about supplies, so we might throw that in there. And then what's another piece of information you listed?
Staffing.
Staffing.
Get the staff to get to and from work.
Yeah, right, so that's
The residents can be able to get in and out of the building if they need to, if they have appointments or emergencies and stuff.
road closures and things. So that partly is knowing about the external world, again, from emergency management maybe. And then staffing itself, that might be someone in an operations role or someone getting that communication with your staff who are technically outside the facility if they're not home. That's great, thank you. Anyone do another one? Anyone do the winter storm that has something that, who else did winter storm? Have anything that didn't come up yet? Oh, a few of you did. We're getting ready for winter, right? Yeah. Did you come up with anything we didn't mention yet in terms of information you want from outside?
So like our lab requires Quest to come in and get our draws and that kind of thing. So would Quest even be coming? So we wouldn't be able to do as much lab. Pharmacy needs their meds delivered every day. Is that going to happen?
Yeah, so we need that logistics box in there again, right? Again, whether you call it logistics section chief or somebody's performing the function, it's still a function, right? Is a services and stuff coming and going. Good. Other winter storm tables, did you have anything we didn't mention yet? You had winter storm in the back? No? Anything? All covered?
Yeah, we covered it.
All covered. Okay. What about who did another hazard? You did tornado. Tornadoes, all right. And what information do you need from outside?
Yeah. The first thing you would need to know what alternative communication options are there. Because if cell phones are going to be down, probably electricity down. So how do we communicate with the outside world?
That's great. Where are we going to get that information from?
I'm guessing the state would have to come in and help us out there.
Yeah, right. You went right to the complex event that Steve's going to talk about. So maybe that might be, maybe your emergency management might help you. We might need to, this diagram was made in 2014. Coalitions weren't as strong, but maybe your coalition's helping you with something here around communication.
Elon Musk.
Elon Musk, we're going to throw it up there, okay. Some Starlink, yeah, okay. All right. Anyone else do tornado or straight line winds? All right, what else? What other, anyone do the IT cyber? That feels real different, right? It looks different, yeah. Yeah, so tell us, and thank you for being on mic, thank you. What do you need to know from the outside world?
So we just kind of went over 2 recent kind of situations that happened in our area with Microsoft going down and then Verizon going down recently. And trying to figure out, you know, what supports we did have in place and then maybe what supports we didn't have in place. We were trying to identify those. That's kind of where we got.
And you mean like in the moment, what support, like what communication was live and what was down? Yeah, so where did you have to go for that? It's complicated. It doesn't really map to a clean box and line, but who, just without worrying about that, where did you get that information?
So for us, with Microsoft being down, that was passed on to us from like our corporate office, and kind of went with them on the
So
updates.
up here, that's where they might kind of put corporate up here. Maybe there's an emergency operator. They probably must have activated a corporate for that, right? Because it was widespread enough.
And then same with the Verizon and the phones down and all of that. Our corporate office was sending us messages and updates and how to go about the different things that are going to come up.
So they were able to do a lot of the coordination and getting some information and push it down to you, so you had to worry less about getting the information from Verizon or from Microsoft or other. Yeah. Let's talk about the cyber thing. How many people activated your emergency plan for the CrowdStrike or for the Verizon outage? Anyone? You did? Other people? For the Microsoft one. Yeah, when you activate, again, use ICS or not, when you bring your IT, someone from IT becomes very important, right? Different than the utility failure, your IT person. So your IT person might be now in your command center with you. Maybe in a specialist role, maybe, but they're definitely as a resource. And they're reaching out to vendors because they have an expertise. Certainly wouldn't want me talking with Microsoft. You wouldn't get as good information back. Right? So your Avengers team, like Steve talks about, looks different for that kind of hazard. Did anyone do the supply shortage? Yeah? What other things did you want to hear about from outside?
So allocation, where we can get more of the supplies from, how much do other facilities have, how are we getting it, when can we get it, how can outside departments, facilities, things like that, how can they help us if we were to, and it's more so coming from like where we work, I suppose, and trying to relate it to real life situations, but if we have patients that need to go to other facilities to receive IV fluids, so those are the things that we were talking about as far as what we need to know from outside our facility.
And that sounds a lot like, again, Levita just spoke to it, so we'll put that box in here around the coalition is helping to broker a lot of that, the information and the supplies, right? And then when it's big enough, we'll talk in a future slide, Department of Health is helping at a higher geographical level, broader geographical level. Yeah, that's really good. So not represented on here, right? Now, if it was of a different type of supply shortage, let's say water or something that wasn't purely medical, maybe you would go over to your, maybe the Emergency Operations Center, Emergency Management might have a role to play where they have access to non-medical type supplies. So you might have information there or access to local vendors or something. So that might look different again, depending on what you're focusing on. Did anyone do mass casualty or epidemic? Okay, so let's talk about the second question. What do you need to share with partners about your facility? This starts to feel a lot the same no matter the emergency, so we'll just take it overall. Folks who haven't spoke yet, what did you come up with for this second question? Tell us your hazard and what information you want others to know about your facility. Anyone?
We have entrance to the building. We had snowstorm, right?
Snowstorm.
Yeah, the ambulance or emergency personnel needed to get there, just reaching out as to the best door to come through.
Best door to come through if you're in a snowstorm. So basically operational, is there any changes to your operations, right? Yep. Did that come up? Did that come up with non-snowstorm, like any changes to your operations? What about cyber, any of these others, tornadoes? You want to know what do you want people to know about your operations? Anyone? That you are operational, right? Maybe no impact. Again, that idea that like the non-information piece is important information. Actually, we're all good, right? We have power, or we don't have power. Yeah. We shut down some services with the saline shortage. What can't we do? Are we starting to shut down, elective procedures? Anything else about what you want to share about your facility? What if you're not you're not impacted, you ever share, you might help other impacted facilities? What does that look like? Anyone ever be in a position to help other facilities? MinTrack, what do you share on MinTrack?
If you have beds available.
Beds, yeah. So I either need beds, we need to move patients, or I have beds. Yep.
Maybe supplies.
Supplies, right? So water, maybe I don't have a water problem, you do, so I can share water. So again, that resources, right? That starts to become a little bit more uniform, this second question, almost regardless of the emergency, just the specifics within it, right? Good, thank you. All right, let's talk about coordination with regional partners. Here's this more lines and boxes. Okay, so back on this slide, the red box was your command center or your conference room, right? Now called command center. Here it is again, your command center. Again, pretty simplified, but there's a lot of coordination going on with bigger incidents kind of up above a facility, so to speak, right? So we got big line there with your healthcare coalition. We've kind of talked a lot about that already. What about with your public health, county public health or local public health? You may or may not, again, depends on the incident, certainly depends on the facility, but who coordinates directly with public health? Can you think of a time or a reason where that happens? Because they can be a resource for some things. Infectious disease, and what does that look like? Right, great. So active TB for 3 years. So they came and worked right outside of the clinic. So they had brought on expertise in both the treatment in the clinic, but also the public information aspect of that. All right, so you're Houston University, so there was a lot of layers there that public health can help navigate. That's a great example. So it doesn't happen, maybe, certainly not as much as with you, that you're coordinating with your coalition, but your public health folks are a resource to you, and if you're scratching your head and you're not sure what they could be useful for, it doesn't hurt to meet them. I am finding a page now in your resource guide. On page 19 of the resource guide, remember the one that you might use more after today. This is a page with a bunch of QR codes for a reason. So if you're like, hey, I don't really know my local or county public health, I'm not sure what they could or couldn't, what we would interface for, and you want to meet them because it's always best to meet people before an emergency and you want to understand their capabilities, you've got a QR code there for local public health departments, and you can look them up. What about your county EOC? Does anyone want to illuminate us or give some examples of interfacing with your emergency management or EOC, like in specific instances? We've already talked in general. Who here knows your county? Yeah, you do?
So one of our sister buildings, just this summer, we had a dam that was failing, and assisted living and skilled nursing facility was right next to the river, was getting impacted. So we had incident command set up there, and all of these different departments were there helping there, but then we also had incident
So that's a big potential incident. Did you end up needing to evacuate? So there was a dam. It was about to possibly, remember we live in the world of potential, right? So it was a potential. So there was a lot of people involved. So your facilities that would have been impacted had it burst, they had incident command, and then you had incident command stood up in case you had to receive patients from there. Yeah, so definitely your emergency operations center is a huge asset there, but they're quite worried about that as well. So if folks don't know your emergency management director, your emergency management department, again, another QR code here is to look them up at the county level, and really great people to know. They certainly would worry about you and your facility, and they may. Again, information resources are just a really great way. The public health and emergency management is at more of your county level. They're closer to you geographically than the coalition, so a really great place to start. And if you don't have those relationships, highly encourage you to build those. If you're looking for one really easy, actionable thing to do as a result of this workshop, there you go. Give them a call, go meet them. And then up above, the EOC is interfacing, up to the state, right, to the State Homeland Security Department through their EOC. You have EMS, the Multi-Agency Coordinating Center, up there coordinating EMS. And of course, the Department of Health is there. They have a Department Operations Center. Most often, your coalition is interfacing with the Department of Health quite a lot. We have a dotted line in some unique circumstances. A healthcare facility may interact directly with the Department of Health and not go through the coalition. More often it's through the coalition, but Erin is here from the Department of Health. I don't know if you want to add anything about your role in this kind of lines and boxes.
I don't think so. The couple things that I maybe want to add that maybe isn't represented on here is that we would be also coordinating with the feds. So if there is federal assets, and maybe you mentioned that, I'm sorry, we would be coordinating with them about that. And then also, we really prefer the way that we coordinate best is that healthcare facilities coordinate directly with our RHPC, their regional healthcare preparedness coordinators, and they coordinate with us, and that's the way we streamline information and communication the best. So, yeah, I think that's what I meant.
Yeah, good, thank you. So essential elements of information, or EEIs, you may or may not have heard that term. That was a push that came really from the federal government to help push states and coalitions to identify consistent pieces of information no matter what the emergency, and using MinTrack, bed count, these facility status, what's operational, and that's kind of broken down, resource needs, patient movement, bed availability. Those are the EEIs identified by the Department of Health in the plan that's linked here. But that's why you might have seen those consistent reporting things before it was required, but in general also the federal government has, if they request and get those the same reporting elements across the nation, that helps with rolling up information over broader geographic areas when something's big. I'd like to talk for a little bit about planning with community partners and stakeholders. And we have a Mentimeter, remember that, so get your phones ready. So let me talk about this and just think about partners or stakeholders that we have mentioned, that you've partnered with in different ways, or some that we haven't mentioned. So we collaborate for an integrated response at a local level. We would collaborate, it's not just you and your coalition, right, or just you and emergency management. There's a whole heck of a lot of other people and organizations that you're helping or that really are helping you. And so we kind of want to get some of these ideas out and going around how do we collaborate before an emergency, when we're planning, so that in an emergency we're all stronger. You might have organizations that represent your patient or resident population, or community-based organizations or faith-based organizations that have space for you. Obviously government, other healthcare facilities, and maybe you engage with them and you have them in your planning committees. Maybe your monthly one, or maybe you're going to someone else's committee. I would love to hear that. Who has people collaborate, play with, come play in your exercises, or you play in theirs? So I'm gonna just go to the next slide for a minute. So if you lost the QR code, I would love to hear about outcomes from planning with your community partners. And again, this is where you can all learn from each other and we can learn from you. So first, go ahead and get that QR code. And while I let you get that, if anyone wants to raise their hand and offer an idea, that would be great. Who plans with a community partner? Anyone? Oh, I'm going to come down. No, I'm not. Stay up here. Planning with community partners, new relationships built. Who wants to talk about new relationships? We haven't mentioned much yet in terms of other organizations that you're planning with. Anyone want to mention a partner? We won't mic you up for this one.
Oh gosh, we're with county sheriffs.
County sheriffs.
Police, local hospital.
Police,
fire.
Police, fire. And tell me, what does that look like that you're planning with them?
Active shooter, kind of on campus with a tabletop. Police is there for very detailed questions and what the response plan would look like in our environment.
Bring them in an active shooter and a tabletop.
Fire, how they respond, what bring victims out of a facility during an active shooter event, what does that actually look like? Investigation stage, the whole 9 yards.
Yeah, so you'll have them come into a tabletop, fire department, police department, so you can really get to hear a real detailed sense of how they're planning. What about even thinking back to COVID? We call, COVID was a thing. It won't ever be repeated quite exactly like that. But did you receive support, anyone receive support from community organizations that might have been surprising and helpful? Who received crocheted masks? Anyone? Yeah, that's good. Did anyone form new relationships with partners? So you got some donations and it was an organization you hadn't really been close with and now it lasted? I know you all don't work alone.
So my facility is kind of not ridiculous, but because we do this community, one of the local banks that did sell for hamburgers and stuff.
A local bank, you said?
Yep. We donated that money because we're putting together. We're putting together a new gym for our residents, so they have a hamburger feed, and that all the proceeds come to us for the gym.
Oh, that's great. Okay, so yeah, so they do some fundraising, and it's helping with your build the gym. That's great.
I know it's not only this, but because we work with the community and we make it a point to be there.
Yeah.
Help out what we can to help us out too.
So what I love about that is it doesn't have to be strictly related to emergencies, right? It's an organization that cares about your facility, that cares about the well-being of your residents, and if you were impacted by something, they'd probably be there to help you in some way. So, yeah, it goes both ways. Awesome. Thank you. Good example. All right, let's see what we've got here. New relationships built, sharing resources, ideas, sharing resources. Thank you. Anyone want to speak to same info for the surrounding area?
Just that everybody's getting the same message.
Everyone's getting the same message. So the more you network with partners, the more you have consistent information sharing. Yeah, good, thanks. Relationships, always good. Sense of community coming together, mutual help and confidence in an emergency. I love that, it's so important. Hearing someone else's viewpoint, right? Helpful resources, being prepared for future issues. Yeah, this is what we're talking about. Details about response plans. You certainly want to know the response plans of your police, fire. What about your vendors? You want to know if your vendors are prepared, and your secondary backup vendor, you want to know that they're prepared because you're depending on them. Or they probably want to know that you're depending on them as well. And then they say, well, yeah, so is every other healthcare facility in this county, and then you know you have a problem, right? Training, a sense of connectedness. Reduce the disruption of resident care, not recreating the wheel. Okay. More effective plans and expectations. It's all about that, right? Sharing meds and supplies. Is that sharing meds and supplies with other healthcare facilities? Healthcare partners, probably? I certainly heard an example during this workshop series where one facility was impacted and other facilities proactively called their coalition to offer, said, hey, we're fine, but here's what we can do to help. So again, that role of the coalition and understanding each other's facilities and populations really helps with that sense of connectedness. Good. Okay, thank you. All right, that's concluding Module 6. So flip back, remember that love note to yourself. If anything sparked an idea, go ahead and make that now.